Today we're going to talk about syncope. Syncope is an important topic because it's a common chief complaint that you'll encounter in the emergency department. Syncope is characterized by a loss of consciousness, as well as a loss of postural tone, and it's also associated with spontaneous recovery, as blood flows back to the head and the patient regains consciousness. When she returns to baseline, the patient may come to your emergency department and you may be charged with assessing her. She'll say something like,
I felt dizzy and I passed out.
and it's up to you to determine, was this really syncope? And if so, is anything serious going on? In other words, do I need to admit this patient? At the end of this syncope module, you should be able to list the common causes of syncope as well as summarize the basic pathophysiology. There are many different causes of syncope, but we're going to keep it simple. You should also be able to recall the criteria that are used in the San Francisco and Boston syncope rules. These rules help us answer our question, do I need to admit this patient? Third, you'll be able to critique the journal articles that gave us the decision rules. And fourth, you'll be able to blend your knowledge and understanding to apply the decision rules and make judgment calls in clinical scenarios. For example, let's say you have a 20-year-old female. She's otherwise healthy, but she has a family history of hokum. She comes in with what sounds like vasovagal syncope. Do you admit her? What about a 28-year-old female athlete who presents with an episode of syncope while grocery shopping after a long morning run, and who's found to have a blood pressure of 89/50? How about a 35-year-old male who says he gets palpitations sometimes, usually when he's feeling anxious, and that this happened today and he passed out? Or finally, what about a 65-year-old man with known CHF who's been constipated for the past week and who this morning lost consciousness immediately after straining to pass a large bowel movement? Do you admit him? You'll meet these patients and others in clinical vignettes later in the module. Let's begin with an overview of the various causes of syncope.